Why don't you go in beside the bed and get my flashlight? That flashlight will...
Oh, that's okay. I got this thing that's light on it, Perry.
Oh, okay.
Do you have a tape measure?
Yes.
Or a ruler?
Tape measure, yes.
Let me adjust the lighting.
About 6 1/4 inches.
Wait a minute. Here. 6 1/4. Okay, now I need the side.
3 3/4.
It's farther than that. I mean, there's some white lines that are part concealed.
Oh, it's almost 4 inches.
Okay.
Wait a minute, he ain't done.
Make sure, yeah, that's a good point. I can see the needle sticks.
Mm-hmm.
Hold on a second, Perry. It's perfectly still.
Trying, man. I'm shaking. I can't help it.
That's the needle sticks from the epidural, right?
Yes.
He had on Monday. Okay. Okay. Perfect. Okay. So we'll try to look right into the camera if we can. Alright, so let's talk about your injury, okay? You're injured, you don't have to get a specific date, but in the 1980s, right?
It was
1980.
1980, yes.
1980, okay. Tell us what happened with your injury.
I fell off a slinger roof and down in the ductwork and landed on a piece of angle iron across the small of my back.
Okay. Now, you've had 3 back surgeries, one of which, the last one, that was performed, you weren't charged anything, right?
No, nothing.
Okay.
Workers' comp wasn't charged. I wasn't charged.
Okay. So, the only evidence of that 3rd back surgery is what? Pathology,
Yeah, the
right?
pathology report where what he took out of my back was examined. Yes.
Right. And other than that, all the other records from your 3rd back surgery,
Gone.
gone, expunged. Can't get them at all. I tried to get the medical records at the hospital. There's no account of it other than that biopsy report from the 3rd surgery. The doctor has since left the state because of why?
Malpractice suits.
Okay. And he was one of the bureau's. This guy that actually performed her surgery. You don't know this, I don't think, but that guy was actually a Bureau IME deaf doctor. Did you know that?
No, I did not.
Yeah, he was a deaf doctor for the Bureau. He did IMEs for the Bureau and denied countless injured workers their rights to benefits and treatments and such, okay? You didn't know that, but,
That's nice.
yeah. So this guy, well, let's move on to your claim, okay? So you had that done, and as your claim goes along, of course you're not any better, right? I mean, after that third surgery, you still didn't improve, right?
No.
Okay. Now, so this guy, or we're moving along in your claim. So, how long? When do you think? What was the approximate year when they cut off all your benefits? They said you were at MMI, maximum medical improvement. When?
I believe that was in 1992.
1992. Okay.
That's when I received a letter from Gates and McDonald's telling me that they would not pay for any more temporary title, any more hospital, medical bills.
No treatment, no medication, nothing.
No,
right?
and no prescriptions. I mean, completely
Okay.
nothing.
So that's Gates McDonald Health Plus. They have a very poor audit record. They can't take care of their own people, let alone process the paperwork correctly, and let alone pay their providers on time. A lot of times they just deny their the treating doctor they deny the medical bills based on bogus coding that they use on their EOBs. Okay, so that's Gates McDonald. Okay, so how long? So that was in 1992. They stopped paying it, right? For all your stuff, they said you're MMI. What did your attorney tell you? First of all, tell us who your attorney was, so that all the other injured workers who are looking at this video will know, hey, maybe I should think twice if I'm going to this joker. Okay, what was the guy's name? Lonis McGonigal?
Yes.
Okay.
I'm sorry. I cannot think very well at all. I can't
okay.
remember very well at all either. But yes, his
Lonis
name was
McGonigal.
right.
Okay. Now this guy is out of where? Is it Canton?
Canton, yes.
Canton, Ohio. Okay. So if you're an injured worker and you're listening to this video, you better think twice.
Don't.
If you have that guy as your
Gates and
legal.
McDonald represent you because he completely screwed me. He didn't do nothing for me.
Well, I mean,
Nothing.
I mean, Lonis McGonigal.
Yeah. I'm sorry.
That's okay.
He did nothing for me. I mean, the last hearing where I actually won my case so that I could get treatment because my employer fought it, he didn't even show up for it. I had to represent myself. Okay? And the only reason that I won was because they lied. They completely lied, and I was able to reveal it. He done nothing for me. Nothing.
Okay, so if you're an injured worker out there listening to this, better think twice.
Oh, more than twice.
You're going to this guy, even though you may be getting your benefits now.
As soon as you get any money, or he gets his money, you're done.
He didn't fight to get any.
Revoke rehab.
Well, hold on a second, baby. He didn't fight to get any conditions allowed on my claim. He submitted it. If they said no, okay, well, they denied it. He didn't try to fight it. Nothing, you know.
Wow.
I was denied, like my wife said, I was denied voc rehab. I applied for it 2 or 3 times, and all 3 times I was denied. And the reason that they put on it was I wasn't a likely candidate. What the hell do you have to be? Half dead?
Right.
You know, I mean.
Okay, so you go to, so all this goes on, you go what, like, I don't know.
I went from 1992, I believe it was, till 2006, I paid all of my own medical bills trying to get help.
How much do you think it was that you paid out in your own money?
Over $20,000.
Did you have to mortgage anything? I mean, did you have to second mortgage anything, or I mean, how did you come up with $20,000 to pay that? Just borrowing it, or
Borrowing it and making payments to collection agencies, and yes, I did make a second mortgage on my home,
Okay.
which I was lucky enough so far not to lose. But
Okay. How?
which brings something else that I would like to bring up here. You know, my first marriage went bad because my wife couldn't deal with my injury, and of course, with no money coming in, I lost everything. I lost the house, I lost the vehicles, everything, completely.
You lost everything.
Everything. You know, I had to file bankruptcy, no money coming in, because I went from 1980 to almost 1984 fighting to get the claim allowed, and I went that entire time with little to no money.
And no surgery.
Yeah, and no medical help. You know, it just,
When did you have your first back surgery?
I believe it was late in 1984. It was in 1984, but I believe it was
4
late.
years fighting, and they finally do the surgery, and it's the wrong surgery. They have to go back and do it again.
Well, yeah, it didn't.
That was in what,
fail-
1990, right?
No.
When was your
My
second?
first surgery was in 1984. My second surgery was in 1988, and the third surgery was in 1990.
Okay.
To the best of my
Okay.
that I can remember.
So then you, all this happens to you, okay, and then,
Okay, and
all right, well, hold on a second. Okay, so all this stuff happens, and now, tell us what changed. Tell us what changed in 2006, okay, that helped sort of bring things back on track to get you some help. Tell us what happened.
my mother-in-law knew a doctor, and she kept insisting that I go see this doctor, and finally I did, and I'm really glad I did.
What happened when you went out to see this doctor? Did you just went out? Did you sit down and talk to him and tell him about your case? And you guys talked for a while about your case, right?
Yes, we talked for quite a while, and one of the first things that was recommended that I do was to fire my lawyer, which was worthless, and which I did, and the treatments that the doctor gave me stabilized me from going any farther into the hole that I was going. It's just a vicious.
Do you think before you went out to this doctor do you think that you had thoughts of suicide?
Almost every day. Almost every day. Just
Because of the ongoing relentless pain.
just pain all the time. I mean, you couldn't get away from it. Of course, you know, I don't have the medications I have now, which you can see. There's a huge list, but
Now, I know we did this earlier, but people, when you say pain all the time, people that are watching this video, they're seeing you, and they don't see, well, pain from what? So I'm gonna ask you to do this one more time. I hate to ask you to do this, I'm gonna have you stand up one more time so we can get so people out there watching this video can see what we're talking about in terms of why you're having all this pain. Let's go ahead and turn around now. Okay, let me get things sized up. See that vertical scar right there for the viewers. I'm gonna light this up a little bit. Starts up there, goes down, all the way down,
Almost to my tailbone.
almost to his tailbone. Then it comes out to the left, over the flank, iliac crest. That's about 4.5 inches. That right there. Okay. And this one here, the vertical one, is what would we say, 6.5 inches or 8 inches?
6.5.
Well, that's visible, but there's
It's
the
all
white.
down.
Yeah, it goes.
It's actually about 8 inches.
Yes.
Because we measured it before. So that's why this injured worker, this Ohio injured worker, has chronic pain. Okay, you can go ahead and sit back down. This is pain that a recent file review, we're going to jump ahead just for a minute here. A recent file review by one Deborah McFarland, a chiropractor, out of New Philly, Dover, Ohio, which there's a link on this site that you can go to and listen to how her office solicits patients. It actually will blow your mind, because if you go to her office, you'll get a free pizza, according to the interview from me.
Well,
Not my interview, not an interview, but my phone call to her office, in which they offered me basically anything I wanted. So it could have been a pizza, it could have been prostitution, I don't know.
Well, the thing that I would like to point out here with this particular report is if she treats her patients like she treats BWC injured workers, she can't have very many patients left.
That's why they were trying to solicit me with a pizza, free pizza, to come into their office. Now I'm going to show you. I'm going to show the viewers this. I'm going to try to get a good picture of it. I'm going to slide this up. Okay.
My name is still on there.
No, I get your name off of there. Okay. Now it says, BWC finds it probable that the allowed sprains and contusions have resolved. Okay. The spondylolisthesis, postlaminectomy syndrome, radiculitis, stenosis, facet, arthropathy, and degenerative joint disease are complicated, chronic, and chronic permanent conditions. See that? Permanent conditions. Okay? The injured worker had a sufficient trial of active corrective chiropractic care with insignificant changes in the examination findings. In fact, there are findings that are consistent with a worsening of the injured worker's condition. Therefore, further corrective care is not appropriate for this 28-year-old claim. Okay. Let's talk about that. Okay. First of all, I like how they use the word corrective. Okay. Do you know why they use that word? That's their scapegoat. Corrective. Just like
It's
your phone ringing, that was pill time.
Yeah.
Tells you when your phone rings and tells you when to
Sets
take
his
your next
alarm because he
medication.
can't
Yeah.
remember.
I can't remember to watch the clock, so I have my phone set up where it goes off 3 times a day to let me know it's time to take my medication.
Whoa! Wow. Okay. Let me sit back down here. Okay. Let's get back on track. Sorry about that for the viewers. I didn't know what that. Put it on pause. So I like how you use the word corrective there, because corrective is kind of like corrective dental surgery. Okay, you know, if you've got crooked teeth, you put corrective braces on. Okay, but that's their scapegoat, and this Deborah McFarland chiropractor, that's the scapegoat there. Corrective care. Okay, obviously the viewers have seen your scars in your back, okay? And we've already talked about the 3 failed back surgeries, the one for which you weren't charged a dime and everything's been expunged.
Right.
In terms of the records, and the only thing left was the biopsy report, okay? So, and this doctor's never seen you. Have you ever seen this Dr. McFarland?
Don't have any idea what she looks like.
Okay.
No.
Well, we're going to find out what she looks like, because we're going to her office, not you, but Victor Vaughn is going to that lady's office, and we're going to get some answers from Dr. McFarland. Okay? So, we're going to jump back here, but in respect to that bogus file review, okay?
Well, that's like the 3rd one.
Yeah. Okay. The bogus file review, okay? Tell us about the treatment that you're getting, the chiropractic treatment you're getting now. Do you think the chiropractic treatment helps you?
Oh, yes.
Okay.
There's no doubt in my mind.
Now, we know that the chiropractic treatment is not anything that with sustained long-term benefits, okay? But it helps you
Maintain
do
a level of living.
a level of living, okay?
So that I don't, like I said, they're just a vicious cycle. You're going down deeper and deeper and deeper into this hole.
And it kind of stops that for a period of time.
Yes.
So for the viewers out there, that's what they call enabling the injured worker to maintain a certain level of functional capacity. Okay?
Okay.
Now, we don't know this, okay? But there was a Supreme Court ruling, okay? Reno Camaruca, okay? That says that as long as treatment enables an injured worker to maintain a certain level of functioning throughout the day, then that treatment meets the test of medical necessity. You didn't know that, okay?
No, I didn't.
That's a Supreme Court ruling, okay? Now, also in that ruling, it talks about what is medical necessity, okay? Well, that's what it is, what I just said, okay? But it also mentions that there is no standard of care that there's no standard of long-lasting benefits, okay, in respect to care, okay? Meaning, there's not any standard out there that says, hey, this is what we see, this is what we call long-lasting benefits, okay? Okay?
Okay.
For example, medication, trigger point injections, okay? They provide you with temporary relief of pain, or temporary, a temporary subdue of pain, okay? So that you can continue to function at a certain level during the day and make your condition a livable condition wherein you're not considering suicide to escape the pain, right? Right?
That's
Okay. So this Dr. McFarland that did that file review, here's a Supreme Court ruling. and here's a file review doctor that completely ignores the law of the land, okay? And, you know, looking at all of your conditions, how many allowed conditions do you have in your claim?
I believe there's 11.
11 allowed conditions in your claim.
11, yes.
Okay? So there are 11 allowed conditions in your claim. That's a lot. Okay? Do you have a bureau of paper around here somewhere that has all the allowed conditions that you can get readily, or you know? But that's okay. That's okay. I have them. I
Yes.
have them out.
If you can take a break for 2 minutes, I can get them.
Okay. So, all right. Where was I at?
On the allowed conditions.
Oh, the allowed conditions. Okay. These are the allowed conditions. Okay. I'm trying to bring these in front of the camera. Okay. Right there. L5 spondylolisthesis allowed. Lumbosacral sprain allowed. Sprain of the sacrum allowed. Radiculitis allowed. And there's the major depressive disorder, which you can see is allowed. Prolonged post-traumatic stress, you wonder why, allowed. Okay. L4-5 degenerative joint disease is allowed. Do you think your post-traumatic stress came from the Gates McDonald's lousy management of your claim?
Yes. Denying everything.
Deny, and they're crooked doctors?
Yes.
Okay, that's what I thought too. L4-5 lumbar facet arthropathy allowed. The list goes on. But according to Dr. Deborah McFarland in Dover, Ohio, you should be healed. Okay?
That's why I have a hard time walking, I guess.
Post-laminectomy syndrome allowed. L4-5 stenosis allowed. Generalized anxiety from their Gates McDonald's lousy case management and their crooked file review doctors allowed. So, I mean, there's 11 allowed diagnoses to your claim. Just like you said. Okay. Alright. Let's move back into this.
And not to bring up a sore subject, but there's probably a few more that should be in my claim.
Absolutely.
Like scar tissue.
Hold on a second.
For one. You know.
Okay. Yeah, scar tissue is one that we're going to be going after. Okay. So, obviously, the treatment that you're getting right now
Is helping me maintain
a certain level of function.
Yes.
Okay. What do you think? Let me ask you this. Do you think that these file review doctors that do these types of file reviews, okay, do you think they should be punished?
Oh, most definitely.
Do you think they should go to jail?
Oh, most definitely.
Do you think there should be ethics complaints filed on these people? Well, like her, if she's a chiropractor, do you think the state chiropractic board should do something about those people?
Yes, I do, most definitely. If someone would anchor down and say to these doctors, hey, you can't do this to a human being. You know, they got laws out there protecting animals, where if you abuse an animal or you mistreat an animal, you go to jail. These doctors abuse injured workers. They
Without
mistreat.
even seeing
Yeah.
the person.
Not even see them. They don't know me from Adam.
Right.
But nothing happens to them. Nothing. You know, you know, these people, these doctors that do all this denying, did they ever stop to think of how many injured workers has committed suicide because these doctors denied them treatment, and the injured worker, what am I supposed to do?
Can't take
I
the
need
pain.
help. I need help. What am I supposed to do? They commit suicide.
Statistically, in 2003, there were roughly 2,300 or 2,100 injured workers that died while waiting for a benefit, for example, treatment. Okay, that's not the number that died from their actual injury. They died while waiting
For treatment.
for treatment because of denials like this Dr. Deborah McFarland, and who else did file reviews on your claim?
Several people.
I mean, there's been a lot of them. I can't think of who they all are. And that number jumped from 2,100, 2,300 in 2003 to in 2006. It jumped up to over 8,000 injured workers. Ohio injured workers died not from the actual injury at the time of injury. They died while waiting for treatment because treatment was prolonged, and these people
Or denied.
They prolonged. They're suffering. You know, they are agonizing, suffering pain, and a lot of those people committed suicide.
You know, these doctors, there should be a way to prosecute them, because in a way they know in the back of their head, I'm denying this person treatment, and this person is really bad off. I'm reading all these diagnoses here. This person is really bad off, and I'm denying this person treatment.
They know what they're doing.
What if this person says, okay, I can't take this anymore, and he goes and kills himself?
Right.
He, she, whatever. That doctor should be held responsible.
Accountable. Yep.
Yes.
Now there have been, from my knowledge, there have been 2 ethics complaints filed against 2 chiropractors who did file reviews on your claim. Okay. One was Charles McMorrow. Okay. The guy's out of Columbus. He's a chiropractor, and he works for Gates and Sedgwick Comp Management Health Systems. Okay. The guy goes around and lectures about EMGs. Okay. This guy says that your injury should be healed. So, okay, that's one. The other chiropractor is Kenneth Jenkins. Okay. He's out of Columbus, Ohio, downtown Main Street or whatever. Okay. Now, that guy says that the rehabilitation that you're receiving now, you can go buy that equipment and put it in your house. Okay. You can go buy that equipment, purchase that equipment, and do all that stuff at home. Okay. That's $40,000 worth of equipment. Do you think you could afford that?
No way.
Okay.
Not even a prayer.
Okay. So an ethics complaint was filed on that chiropractor. So what we're going to do is we're going to see what the state chiropractic board does. Okay. Also, a criminal complaint was filed on a hearing officer, Clement Rogers, in the Canton hearing office. Okay. A criminal complaint was filed on that joker. Okay. Why? Because he didn't consider all of the evidence at the hearing. Okay. The most important evidence was your testimony. That what? What did you testify to at the hearing?
I testified, and I told him that if it wasn't for the treatment that I received from your office, that I would have killed myself. I would have committed suicide.
Okay.
If it wasn't for that treatment. It was bad.
What did you say when you said that?
He just looked at me. Never said a word. Just looked at me.
And then when you walked out, he denied you your treatment.
Yes.
Okay. So 2 ethics complaints against Charles McMorrow and Ken Jenkins, both chiropractors, who at some point, the state chiropractic board will have to do something with their chiropractic quacks who are out there doing file reviews and bastardizing their oath when they became a doctor.
Well, I tell you
They
something.
bastardized the Hippocratic Oath, and those guys are violating ethics left and right. And so we're going to see what the state chiropractic board does with those jokers, and we're going to see what the industrial commission does when they have a hearing officer who does not consider the full weight of the testimony, the full weight of the evidence, of which, in my opinion, the weight of the evidence is skewed in your favor, okay, based on the fact that you gave your own testimony at that hearing as to the medical necessity of your treatment versus two file review doctors who've never seen you before.
Don't know anything about me.
And one says you can go buy $40,000 worth of rehab equipment to use in your house. And the other one says that your injury should be healed. Well, we just went over all that about, you saw the scar, the viewers saw the scars on your low back, and the viewers have heard about the back surgeries, okay? So, we're going to see what happens with that.
I would like for some of these doctors that say, my treatment is medically not necessary. I would like for them to walk in my shoes for 1 week. 1 week. One day would do the trick, but 1 week. Okay? Guaranteed they would have a complete outlook on any decision they would make from that point on.
Their minds would definitely be changed.
Yes. They would have a whole different outlook on whether someone should be healed or someone isn't.
Right.
I struggle to walk most days. Just walk.
Tell us about how it's been with your guys' your family relationship. Your relationship. Do you think it's been a big strain?
It's been a major strain. My wife is a very wonderful person, and I pity her. I pity my wife very, very much. I can't say how many days that I have seen her sitting and crying because she's watching the hell that I'm going through. And there's nothing that she can do to help me. The emotional strain on my wife, I know what the emotional strain is on me dealing with the pain and trying to go every day. I just cannot imagine the pain that she has to live with.
What concerns?
It's hard.
What concerns do you have about him? What's your biggest fear?
One day I'm gonna come home from work and he's gonna be there dead. He's gonna kill himself. And that's my biggest fear. Every day I come home, I'm gonna wonder what I'm gonna walk in the house to.
That's your biggest fear.
Not that he ends up in a wheelchair. That doesn't bother me in the least because I'll be right there by his side. But the fact that I'm going to walk in, I never know what I'm going to walk into.
Do you think it would be much easier in terms of the stress on your relationships, you two? Do you think it would be much easier if they would just say, you know what, you have legitimate injuries, obviously, from anybody that seriously reviews your claim file. Just get the things that you need to get so you can function throughout the day. Would that make your life a lot easier?
As long as he would get the help that he needs and not suffer like he has been. I realize that there is people out there that abuse the system, but he is not one of them. They ought to take each one of these cases individually and look at them closely. Not just say, oh, this is a statistic, I'm going to get money for this, and just blow him off.
Right, that's a good point that you brought up. Each case individually, okay? That brings us back to these bogus guidelines that these doctors use, okay? The OGG guidelines says, 18 treatments and you should be healed. Well, that's the case, and you should have been healed, in 1980. Okay, now, in these chiropractic mercy guidelines, which are a joke and a half. I mean, what they did when they developed these guidelines was they got all their buddies together, they connected people, and they said, hey, here's what works best in our office, and they came up with these bogus guidelines. They've been thrown out in just about every state, okay? Now, you bring up the individuality of each case, and it's exactly what should happen with case management. Don't you agree?
Yes.
You should look at each case individually. They should not say, look, you have this diagnosis and that diagnosis, and that's supposed to heal in 6 to 12 weeks. What do you want to do when you see a file review like that, or an IME examination report like that? Does it make you just want to go and just strangle the guy?
I won't say what I really like to do, but yes.
How do you think that these guys, the big question is, how do these people go home to their families, these doctors?
I'd like to know is how they sleep at night.
Yeah. How do they sleep?
When they're screwing all these injured workers that really do need the help.
Yeah.
How do they sleep at night? They have no conscience. They couldn't.
Yeah. Okay. Let's move on with this. You gotta cope with this pain. You have pain you have to deal with.
You see, the worst part about it is the pain stays at a certain level, and then you start trying to walk or move, and instantly the pain skyrockets. And the thought goes through your mind, I need help. What am I going to do? And seconds later, you're in an anxiety attack that resembles a heart attack. It feels like someone's sitting on your chest. You can't breathe. Your arms go numb. It's not just physical.
Mental.
Yes, it's hell mental too.
Okay, let's talk about. Let's pan down here. Okay. Let's all right, let's talk about your medication. Okay. You take a lot of medication, right?
Yes, sir, I do.
Okay. Let's look at this medication. Here they are. Okay. Let's start at this one. The one at the very end.
This one?
Yep. What do you take that for?
This is
Just, here, hold on a second. Put, if you can't put that back down there, just put your finger over it.
Oh, okay.
Okay. If you don't know, just look, because I want the audience to see.
Okay.
I want decision makers to see that according to these file review and IME doctors, okay, you should be healed, okay?
Yeah.
I want you to tell me what each one of these medications is for. Okay, go start the one over there.
This is a bladder medication because I am retaining 20 to 30% of the urine. My bladder doesn't empty out.
What is that from? From the nerve damage?
From the nerve damage in my back.
Okay.
Yes. This one is Lyrica. This is to treat nerve damage.
Okay.
This one is
nerve damage from your back.
the Lyrica for nerve damage.
Okay.
This is Ativan. This is to help treat anxiety attacks.
Okay.
this is, I can't pronounce the name of it, but it's a stomach medication because taking all this medication, I get sick to my stomach, and this is a medication to help me not be sick and not, to help me not throw up.
So it doesn't eat up your stomach.
Right.
Okay.
This one is a medicine for very, very severe spinal headaches. This is a stomach medication that's Nexium.
Okay. It's okay, take your time.
This is Flexerol. It's a muscle relaxer because of the muscle spasms I have in my back and my legs. This one is Dilaudid. It's a very, very strong painkiller. And this one is Percocet. It's also
It's a breakthrough pain.
a fairly strong painkiller for breakthrough pain. Yes.
And you got your 2 patches.
Oh, also we have the
What's that called?
phenol patch.
Fentanyl?
Yeah,
Fentanyl?
fentanyl patch. That's very strong painkiller. And this is a Lidoderm patch, and it's
Hold that up there, buddy. Sorry.
a Lidoderm patch.
With Lidoderm?
Yeah, okay, Lidoderm patch.
Okay.
And it's also for pain.
Okay. Okay. Sorry, you can go ahead and sit back down. That's all the pain medicine you take, but you should be healed. That's what those guys say. Okay?
Yeah.
That comes from those, the people that, that's what those guys say. And the state chiropractic board, and the state medical board, and the state psychology board won't do a damn thing about this, guys. But, look at all that. That's a lot of medicine.
Now workman's comp is also stopping paying for a couple of his medicines.
They won't pay for
The
Nexium.
Lidoderm patch or the Nexium to help his stomach.
They don't
To
want you to
keep
get
his
conservative care, but they want you to have...
Because the Nexium is expensive, and that's to keep him from having ulcers from all
the
the
medication.
pain medicine that he's on, and they will not pay for any more of the Lidoderm patches.
So they won't pay for no more Nexium or the Lidoderm patches.
They don't want you to have any medicine, but they don't want you to have any conservative care. Okay. Let's, I'm gonna do something here. Okay. I'm gonna move all this stuff. Right here. Put this there. Oh, sorry.
That's okay.
And let's look at this. That's what you take every day. All that.
Yep.
You take all that every day, right?
Yes.
Move those bottles back a little bit more, will you? Thanks. Okay, perfect. That. That's all those bottles. How many pills is there? You count?
4 and 4's 8. 4's 12. 4's 16. 4's 20. 4's 24. 27. 31 pills.
31 pills a day. Times 7 days a week. Or is it?
Calculator, I can't think.
That's 200 and something pills. Let me see here. Let's calculate this, okay? 31 a day times 7 days a week. 217 pills a day, or a week. 217 pills a week times 52. You're taking 11,284 pills a year.
And the sad part about it is I can tell that all this medication is tearing me up inside.
11,284 pills a year.
Plus all
And
the
they
patches.
say these chiropractors, file review doctors, and independent medical examination doctors say you should be healed. They say you should be healed. Do you think there should be a class action lawsuit? Do you think that you're the only one who's in this boat right here?
No. I know I'm not. I know I'm not. Because you said that there was several thousand suicides from the maltreatment from these MCOs. So there has to be thousands of people that are in my shoes. Their claim might not be as old as mine, but their problems and medical issues are like mine.
Yeah. Okay. Is there anything else we wanted to talk about?
If there is, we can pick it up another day.
Yeah, I think that's it. That's a lot of pills.
No.
Yeah, I mean, there's nothing you can do in terms of, you know, you're not going to fix your problem. And you realize that. But wouldn't it make it a lot easier for you stress-wise, okay? Do you think you may not have to take as much psychological medicine? This is a good question. Do you think you might not have to take as much psychological medicine if they would just say, hey, just get the stuff you need to get so you can function throughout the day? We know you're not going to get, you know, this isn't going to go away. This isn't going to resolve. You got permanent problems. Just get what you need to take care of yourself. Do you think that that would help?
Oh, yeah. Let me say something here. There is so much unneeded stress. Every time you turn around, you have to fight to get medical treatment, medically necessary treatment. Not just medical treatment, but what I consider medically necessary treatment. You have the appeals. You have to go to the hearings. If you did not have all this undue stress, unnecessary stress, yes, a person would get better. But you're always wondering from day to day, what fight am I going to have now? What is going to be denied? It's a vicious circle. I mean, how can anybody actually get well having to deal with this?
Let me throw this out here now. This the guy who's the basically the spokesperson for the MCO League, okay, says that they're doing an excellent job helping you guys. What would you say to that guy?
He needs to have a reality check.
Yeah, he says that they're doing an excellent job helping Ohio's injured workers. They've saved the state so much money.
If he even talked to any of the injured workers, he'd find out different.
He's doing an excellent job of screwing the injured worker.
Yeah, I don't remember the guy's name. Must not have been that important. Okay, I guess that concludes this. Is there anything else you want to say?
No, I think I've read the second.
All right.